Well, thank you very much, Mr. Chair and Ranking Member, for having this hearing today, and thank you for our witnesses for being here. The COVID-19 pandemic has led to a rapid expansion of telehealth services, as we're discussing right now, many of which are long overdue. Telehealth can continue to increase access to care and improve health outcomes, even outside a pandemic. So I'm glad that we're having bipartisan discussions about making many of these services available to patients permanently. Dr. Aurora, I want to start with a question for you, and I want to thank you for your work establishing the Project ECHO program. And I want to thank you too today for sharing your experience with that patient who inspired you to take this on. Thank you for dedicating so much of your skill and your heart to making telehealth a reality for so many. In my home state, University of New Hampshire created an ECHO hub that has expanded access to medication-assisted treatment for substance use disorder. However, there are still barriers that prevent people from accessing treatment, particularly during the COVID-19 pandemic, including an outdated requirement that providers obtain a DEA waiver in order to prescribe buprenorphine. And there was a discussion between Senator Baldwin and Dr. Ruban about this, but I want to drill into it a little bit more. The DEA is temporarily allowing teleprescribing of medications that treat substance use disorder during the pandemic. However, because the DEA buprenorphine waiver requirement has significantly limited the number of providers who can prescribe, access through telehealth remains unavailable to many Americans. Last year, Senator Murkowski and I introduced legislation that would eliminate the DEA requirement. Dr. Aurora, how has COVID-19 exacerbated existing challenges for substance use disorder patients and providers in underserved areas? And how might those challenges, combined with administrative barriers like this DEA waiver requirement, limit treatment during the pandemic?
Senator Hassan, thank you for your question. And in addition to University of New Hampshire, Dartmouth Hitchcock, and John Snow Research Institute in Europe also are using ECHO for substance use disorders in New Hampshire. And in New Mexico, when we started ECHO, there were only 33 doctors who had the DEA waiver. And we used ECHO to train 500 more and certified 500 more physicians for the that time it was physicians, now nurse practitioners, to actually have the DEA waiver. But what we found was even with the waiver, most doctors don't have the expertise to take care of a patient with substance use, because you also needed mental health expertise and you needed other kinds of counseling expertise. So when we set up ECHO, what we found was we helped them with the DEA waiver, but then gave them the mental health support they needed to take care of the patient. But my perspective is exactly the same as you, Senator Hassan, that in the event, we have now set up 100 hubs in the United States for substance use disorder, connecting at least 20,000 clinicians to be mentored for this particular problem for which there's a great shortage. But in my view, when a primary care doctor, a nurse practitioner, a rural area is participating in an ECHO for substance use disorder in one of these 100 networks, they don't need a DEA number for that. They have much more than a DEA number can provide or a license. In fact, in that circumstance, waiving that will dramatically expand access to substance use disorders in our country.
Thank you for that. And Dr. Ruban, do you have anything to add? I appreciated your earlier testimony.
Just that we are appreciative of the home as an eligible originating site for patients for substance use disorder treatment, and we look forward to the DEA creating also the special registration for telemedicine providers.
Well, thank you. I have a question for Dr. Kevedar too. As we increasingly rely on telehealth services during the pandemic, we need to ensure that electronic health records are accessible across provider settings and matched to the correct patient. Accurate, interoperable electronic health records could also play a critical role in ensuring that a COVID-19 vaccine is distributed efficiently, available to vulnerable populations, and if a vaccine requires a booster, that the correct doses are being administered to the correct patient at the correct time. Dr. Kevedar, can you briefly explain how data standardization, better demographic data collection, and improved access to electronic health records could increase provider efficiency and improve patient experience as we continue to respond to COVID-19?
Well, thank you so much for the question. It's an incredibly important area for us and slightly outside of the tight zone of telehealth, but really an important one. For everything that you said, it turns out that there's a new set of tools in the coder lexicon called APIs that enable us to easily match data sets. That's very important. The other thing that I would just mention is that the Postal Service has a way of matching addresses that we should take advantage of. I think that has been underutilized and is a very perhaps elegant solution to some of the problems you're mentioning. And yes, important for all of us to have accurate information and to be able to share information, especially in this new world where everything is time and place independent.
Well, and
Thank you,
for that.
Senator Hassan.
Thank you, Mr. Chair.
We have